Imagine this. You're watching your horse, your magnificent, usually vibrant horse, and suddenly something is just off. Disoriented, maybe stumbling, maybe even pressing their head against the wall, or worse, collapsing into seizures. It's a really dramatic, perplexing scenario. It can leave even experienced horse owners totally baffled. Makes you wonder, what on earth could cause such a drastic, sudden shift? Well, today we are taking a deep dive into exactly that, a condition called hyperammonemia in horses. We're going to, sift through the details of ammonia, its role, and what happens when the seemingly simple compound goes terribly wrong. We'll be drawing on all the fascinating insights from the articles and research you've shared with us.
Yeah, and our mission today is really to give you a clear, kind of comprehensive understanding of hyperammonemia. We'll explore everything from like the basic chemistry to the causes, how we actually diagnose it, and the treatments in horses. We're hoping for those aha moments that connect the dots.
All right, let's go back to square one then. What is ammonia, really? And why is this molecule so problematic when things go wrong? At its most basic, ammonia, NH3, it's a non-protein nitrogen compound. Now, here's where it gets a little tricky, right? In the blood, most of it is actually the ammonium ion NH4 plus cent. But it's the free ammonia, the NH3, that's the real culprit. It's the one that can easily permeate cell membranes and cause all the trouble.
Kind of like the ghost in the machine.
Exactly. That free uncharged ammonia, the NH3, that's the one that just slips through membranes. And normally, mammals have this really sophisticated system for handling waste nitrogen. The main way, the most efficient, is converting it into urea in the liver.
Right, urea.
Which then gets safely excreted by the kidneys. And then there's a backup, converting it to glutamine, which happens in various tissues, including the brain. Okay, so when we talk about hyperammonemia, we're basically just saying there's too much ammonia. It's when those plasma ammonia levels go above the lab's reference range. Just for context, typical normal ranges are usually pretty low, generally below, say, 50 to 80 micromoles per liter.
Right.
But what's really striking is that you often don't even see clinical signs until concentrations are way higher. We're talking maybe 100 to 200 micromoles per liter. It's like the body has this huge buffer, and by the time you see a problem, it's already pretty significant.
It's true, and that buffer capacity is something else. What's also really crucial, though, for anyone looking at lab results, is remembering that those reference intervals can actually vary quite a bit. Depends on the specific test method, the lab doing it. So understanding the specifics of your lab report is incredibly important. You can't just look at a number in isolation.
Right, makes sense. So we know it causes chaos once it builds up, but where does this stuff actually come from in the horse's system? What's its usual journey?
Well, the main source, and this surprises some people, is the gastrointestinal tract, the GI tract. It's a busy place. Dietary nitrogen from protein, bacterial enzymes like proteases and urases, amine oxidases, they all contribute significantly to producing ammonia. It's just a constant byproduct of digestion, really.
So the gut is basically an ammonia factory.
In a way, yeah.
Yeah.
And it's not just the gut. Ammonia also comes from the normal breakdown, the catabolism of glutamine and other proteins elsewhere in the body. And even from intense exercise like skeletal muscle exertion. We see that sometimes in endurance horses.
Interesting.
Once it's produced, especially in the gut, it gets absorbed and heads straight into the portal circulation. That's the blood vessel highway leading directly to the liver.
And this is where the liver steps in, the detoxification hero. Ammonia arrives via that portal vein or the hepatic artery, and then the liver cells, the hepatocytes, they get right to work. They convert it to urea through this process called the Krebs-Henselite urea cycle, like the body's internal water treatment plant.
And what's truly fascinating here, really an aha moment, is just how much the liver can compensate before we see a problem. Think about this. Up to 70%, 70% of the liver's mass can be, well, not functioning properly before you even detect hyperammonemia in the blood.
Wait, 70%? That is staggering. That means by the time you actually see a horse with high ammonia and clinical signs, their liver could be in serious, serious trouble. It might have been struggling for ages.
Exactly. It shows incredible resilience, but it's definitely a double-edged sword. Because if that functional liver mass isn't enough, or if it just gets overwhelmed, ammonia simply isn't converted to urea efficiently.
And it builds up.
And the plasma concentrations go up. The urea, like we said, normally gets excreted by the kidneys. And that glutamine synthesis pathway is another important backup, especially in muscle and the brain.
Okay, so it gets into the blood, goes to the liver, gets processed, ideally. But what happens if it doesn't get processed properly? What's the real danger, especially once it gets to the brain?
Yeah, this is where the direct neurotoxic effects become so critical. Ammonia, remember the NH3 form? It readily crosses the blood-brain barrier. Doesn't need a special invitation, just diffuses right in.
Oh, wow.
And once it's inside the brain, it's like a saboteur. At the cellular level, it messes with the neuron's power supply, it inhibits ATP production, messes with the Krebs cycle, basically starves those brain cells of energy.
No energy, no function.
Right. And it's not just energy, it also jams up communication lines, interfering with the balance of neurotransmitters, particularly glutamate and GABA.
Yeah.
It impacts mitochondria, can cause oxidative stress. It's a full-on assault on the brain cells.
And one of the most alarming effects, the one that leads to those really severe signs, is something called cytotoxic cerebral edema. Can you break that down?
Sure. So when ammonia is metabolized inside astrocytes, these are important support cells in the brain, it can actually increase the fluid inside those cells, makes them swell up.
Swell.
Yeah, they swell. And that swelling can increase the pressure inside the skull, the intracranial pressure, which causes even more damage. It's literally swelling the brain from the inside.
That sounds terrifying. And this links to hepatic encephalopathy, right?
Precisely. But it's important to clarify, while ammonia is a major player in hepatic encephalopathy, it's not usually acting alone. There are other neurotoxins involved, things like altered neurotransmitters, increased GABA activity, issues with glutamate receptors, maybe other stuff from the gut like mercaptins or short-chain fatty acids.
Okay, so it's a cocktail of toxins, not just ammonia.
Often, yes. And that's why the level of ammonia in the blood doesn't always perfectly match how sick the horse looks. There are these other factors contributing to the neurological signs. It makes it complex.
And if this keeps going on, chronic hyperammonemia, that causes lasting damage.
Absolutely. It can lead to visible degenerative changes in the neurons and those supporting astrocyte cells. So yeah, long-lasting consequences for brain function if it's not managed.
So why does this whole system fail? Why do ammonia levels shoot up like this in horses? What actually breaks down?
Well, the most common reason is decreased hepatic clearance, basically liver failure or severely impaired liver function. We see this with serious liver diseases, things like hepatitis, cirrhosis, which is that end-stage scarring, Thieler's disease, chronic active hepatitis. The liver just can't keep up.
And I guess some of those liver problems are caused by things the horse encounters, toxins.
Absolutely. Sometimes the liver damage comes from specific toxins, things like pyrrolizidine alkaloids from certain weeds, getting too much iron, blue-green algae toxins, mycotoxins, and moldy feed. Even urea poisoning if they accidentally eat cattle feed with high urea levels.
Right.
Ammonium salt fertilizers are another one. Or just other drugs or chemicals that are toxic to the liver. And then you've got infectious causes like Tisser's disease, which is a big worry in foals.
And you mentioned something called portosystemic shunts, PSS. That sounds different.
It is. PSS is another major cause. These shunts are basically abnormal blood vessels. They let blood coming from the GI tract completely bypass the liver.
Bypass the liver.
Yeah, it goes straight into the main circulation. So all that ammonia absorbed from the gut, which hasn't been detoxified, goes directly to the brain. These shunts can be congenital, a horse is born with them, more common in foals, or they can be acquired later, often due to chronic liver disease, increasing pressure in the portal vein.
Wow. Okay, so the liver might be okay, but the plumbing is wrong.
Exactly.
Yeah.
Or, if we connect this to the bigger picture, sometimes we see cases of increased ammonia production from the gut. It's often called enteric hyperammonemia, or sometimes idiopathic if we can't find obvious liver failure.
What causes that?
It happens with GI diseases. Things like gut stasis, an imbalance in gut bacteria dysbiosis, or maybe increased gut permeability from colitis, impactions, obstructions. These can lead to an overgrowth of specific bacteria, the ones that produce urease.
Urease, that breaks down urea into ammonia.
Right, so these bacteria churn out so much ammonia that it just overwhelms even a healthy liver's capacity to process it all. The treatment plan is fine, but the incoming river has suddenly turned into a flood.
So it's not always a bad liver.
Yeah.
Sometimes it's just an overwhelmed liver. That's a key distinction.
It really is. And then there are less common causes, too. Very high-protein diets can sometimes just overload the system. NPN toxicity, like we mentioned with urea. And surprisingly, exertional hyperammonemia can pop up in some endurance horses after really intense exercise. And very rarely you might find inherited defects in the urea cycle enzymes themselves.
Okay, we've covered what it is and why it happens. Let's talk about what it actually looks like. How would someone recognize these signs in their horse?
Well, the clinical signs are primarily neurological, affecting the brain and nervous system, which makes sense given ammonia is neurotoxic. They can vary a lot in severity, can progress really quickly, and interestingly, sometimes get worse right after the horse eats.
Why after eating?
because digestion ramps up ammonia production and absorption from the gut.
Ah, okay. What are some of the maybe the milder, earlier signs someone might
You
notice?
might see things like lethargy, just general depression, maybe loss of appetite, anorexia. You could notice proprioceptive deficits. That means they're kind of clumsy, maybe stumbling in coordination, ataxia. Sometimes they show cortical blindness. They seem blind, but their pupils react to light okay. Their brain just isn't processing the visual info.
Hmm.
Head pressing is a classic one, leaning into walls or objects. Excessive yawning. Subtle behavioral changes like pacing or circling in the stall. These are all clues that something's not right upstairs.
And when it gets severe, it sounds like things can go downhill fast.
They absolutely can. We're talking profound obtundation or stupor. The horse is barely responsive. That can progress to recumbency, where they physically can't stand up. Seizures are possible, even coma. You might see muscle tremors, especially around the face and ears. And sometimes, weirdly, aggression or excitement, like a sort of mania. Difficulty swallowing dysphagia, that can happen too.
Beyond the neurological stuff, are there other physical clues we should look for?
Yes, especially if there's chronic underlying liver disease. You might see things like stunted growth, poor body condition overall, maybe a rough hair coat, and signs of general liver problems like icterus, that yellowing of the gums or the whites of the eyes. And in animals that have been affected for a while, that neuronal damage we talked about often leads to persistent neurological signs, even if you manage to lower the ammonia levels temporarily.
Okay, so the detective work starts with spotting those neurological signs, but then you need to confirm it with blood tests, right? And rule out other things.
Exactly. Diagnosis involves recognizing those signs, but then you must confirm elevated blood ammonia. And yeah, differential diagnoses are crucial. Could it be a primary neurologic disease like rabies, or even something behavioral? You have to consider everything.
No, you mentioned the blood test. Tell us more about that because you stressed the handling.
Yes, this is probably one of the most critical practical points. Sample collection and handling for ammonia is everything. Ammonia is incredibly unstable. It's labile. In blood samples, any delay or not handling it properly, like not spinning the blood down to get plasma immediately and putting it on ice or freezing it straight away, can lead to falsely high results.
So a bad sample gives you a wrong answer.
A completely misleading answer. It wastes precious time, leads to wrong conclusions. It's incredibly important to get that handling right from the moment the blood is drawn. Communicate that urgency to your vet tech or whoever is handling it.
Got it. Handle with extreme care immediately. So assuming you get a good sample, what other tests help figure out the cause?
Liver function tests are key. If you see elevated liver enzymes, things like SDH, GGTT, AST, ALP, and also high bile acids or bilirubin, that strongly points toward liver failure being the root cause.
But what if those liver tests are normal or only a little bit off? Does that rule out hyperammonemia?
Crucially, no. And this is so important. If the standard liver enzymes and bile acids are normal or near normal, that actually makes you suspect other causes, like that enteric hyperammonemia from the gut or a portosystemic shunt.
Because the liver cells themselves might be okay?
Exactly. The liver tissue might be fundamentally healthy, but it's either being overwhelmed by too much ammonia coming from the gut, or the blood flow is bypassing it entirely because of a shunt. It's a key diagnostic fork in the road. And practically speaking, bile acid tests are often preferred over ammonia tests sometimes, just because they're a bit easier to handle reliably.
Makes sense. And I assume you look at other things too, like blood counts, electrolytes.
Oh yes, we'll run other supportive tests, blood glucose, BUN, and creatinine for kidney function, complete blood count, CBC, electrolytes, just to get the whole picture. And imaging, like an abdominal ultrasound, is really useful for looking at the liver's size and texture. And sometimes you can even spot shunts that way, though confirming shunts might need more advanced imaging like scintigraphy.
And a biopsy, is that common?
A liver biopsy can be incredibly valuable to figure out the specific type of liver damage, if there is any. But you absolutely have to check clotting function before doing a biopsy. Liver failure often messes with blood clotting factors, so there's a higher risk of bleeding. Safety first.
Okay, so we figured out what's wrong, hopefully why it's happening. Now the big one. What can we actually do about it? How do we treat these horses?
Right, treatment is multifaceted. We need to reduce ammonia production and absorption, especially from the gut. We need to help the body detoxify the ammonia that's already there, and we absolutely have to provide supportive care for those neurological signs.
Let's start with diet. What changes there?
Diet is huge. We switch them to a very low protein, high carbohydrate diet. Small, frequent meals are usually best. And highly digestible fiber sources like beet pulp or soy hulls are great because they encourage a healthier gut microbiome, which can actually help process some ammonia. Definitely avoid high-protein feeds like alfalfa or other legumes.
Okay, low protein, high carb, good fiber. What about medications? You hear about lactulose a lot.
Lactulose is a cornerstone, really. It's clever. It works in two ways. First, it acidifies the colon, which helps trap ammonia as the less absorbable NH4 plus ion, basically keeps it in the gut. Second, it's an osmotic laxative, meaning it draws water into the gut and speeds up transit time, gets the ammonia-producing stuff out faster.
So it traps it and flushes it. What's a typical dose?
Usually around 0.25 to zero point 0.5 milliliters per kilogram of body weight given orally, maybe every 8 to 12 hours. You adjust based on the horse's response, looking for slightly soft manure.
Are there other meds used for the gut? Antibiotics?
Yes, sometimes oral antibiotics like neomycin or metronidazole are used short-term. They help knock down those urease-producing bacteria in the gut that generate ammonia. But you have to be careful. Neomycin can be tough on the kidneys, and metronidazole can actually cause neuroscience itself if the liver isn't clearing it properly. So not usually for long-term use. In really severe acute cases, you might even do enemas or a colonic lavage to physically clean out the gut quickly.
And what about general supportive care? Fluids and such?
Absolutely critical. Intravenous fluids are essential for hydration, supporting the kidneys so they can excrete waste, and providing dextrose. Giving dextrose provides an energy source so the horse doesn't break down its own body protein for fuel, which would just create more ammonia. And keeping potassium levels normal is surprisingly important. Low potassium can actually make hyperammonemia worse.
Any newer or more experimental treatments on the horizon?
Well, things like ammonium scavengers, L-ornithine, L-aspartate, or LOA are used more in humans and are considered somewhat experimental in horses, but they are an option sometimes used to help the body's own detoxification pathways.
And for managing those scary neurological signs, keeping the horse safe.
That's paramount. Careful sedation is often needed, but you have to choose drugs that aren't heavily metabolized by the liver, so avoiding things like benzodiazepines is wise. Anti-seizure meds if necessary. Keeping the horse in a quiet, dark, padded environment is crucial to minimize stimulation and prevent them from hurting themselves if they're stumbling or head pressing. And ultimately, of course, you have to treat the underlying cause if you possibly can, whether that's specific medical therapy for the liver disease or maybe surgery to tie off a portosystemic shunt.
So after all this, the treatment, the supportive care, what's the outlook? What does this all mean for the horse's future? Let's talk prognosis.
Yeah, the prognosis. It's generally guarded for most causes, honestly.
Yeah.
It really varies hugely depending on what the underlying problem is and how severe the signs were when treatment started. For instance, if it's enteric hyperammonemia that responds quickly to treatment, or maybe a congenital shunt in a foal that's successfully fixed with surgery, the prognosis can actually be pretty good. The liver might recover, or the bypass gets fixed.
But for the more severe cases,
For severe irreversible liver failure, or horses with really bad seizures that don't respond well to medication, or cases of acute NPN poisoning, the prognosis is often much more guarded to poor. The damage might just be too extensive or the initial insult too overwhelming.
so it really sounds like catching those neurosigns early, getting that diagnosis done quickly and correctly, especially handling that blood sample right, and then starting aggressive, targeted treatment. That's what makes the biggest difference for improving the outcome. As we wrap up this deep dive, wow, it's clear how incredibly complex hyperammonemia in horses is. It's kind of amazing, isn't it, how a seemingly simple waste product like ammonia can cause such devastating effects when the body's own, usually brilliant detoxification systems get overwhelmed. It's a real reminder of how delicately balanced everything is inside the horse.
It really is.
Yeah.
And it raises an important question, I think. Given how remarkably the body can adapt and compensate, sometimes for a long time, what other subtle metabolic shifts might be happening when one system like the liver is under stress long before we see those dramatic clinical signs? Now, how might understanding those earlier changes lead to even better, maybe more preventative care in the future?
That's a really profound thought. It highlights that interconnectedness of all the body systems and just how vital a healthy liver and a healthy GI tract are for, well, for everything in equine well-being. It definitely makes you appreciate all the unseen work that's constantly going on inside.